If you are over 60, there is a quiet detail in your bedtime routine that many people never question. Yet it can affect how steady your circulation stays through the night. Most evenings you feel fine, you turn off the light, you fall asleep, and everything seems normal. Then morning comes and suddenly your body feels different. Your balance feels off. Your words feel slower. Your arm feels heavy. It can be confusing and scary, especially because it can happen without obvious pain while you are asleep. Tonight, I want to walk you through 9 common sleep positions and nighttime habits that can put extra strain on circulation, breathing, and pressure regulation in older adults. This is not about panic. This is about awareness. Small changes can support steadier oxygen delivery and smoother blood flow overnight. And when you improve the way your body rests, you give your brain and your heart a calmer night to do their work. One important note before we start. I am not your doctor and I cannot diagnose anything here. I am sharing practical, safety-first ideas that many people can discuss with their clinician, especially if they have high blood pressure, irregular heartbeat, snoring, daytime sleepiness, diabetes, or a history of circulation problems. Now let us begin with number 1. Sleeping flat on your back with no pillow. A lot of people like sleeping flat, no pillow, head level with the chest, arms at the sides. It can feel simple and natural, and some people believe it helps the back. But as we age, flat sleeping can sometimes make it harder for the body to manage pressure and drainage from the head and neck, especially in people with stiff vessels or breathing issues. Here is the idea in plain language. During the night, your circulation slows. Your breathing can become shallower. Your body also loses moisture through the hours, which can make the blood slightly thicker by morning. If your head is completely level, some people experience more congestion in the upper airway, more snoring, and less smooth oxygen flow. For some, that combination can lead to bigger swings in pressure and less stable circulation right before waking. A gentle adjustment often helps. Raise the head and upper chest slightly. Think of a small incline, not sitting upright, just enough so gravity assists breathing and comfort. A wedge pillow can do it, or a supportive pillow setup that keeps your neck in a neutral line. The key is support, not bending the chin toward the chest. You want the airway open and the neck relaxed. If you have reflux, snoring, or wake up with headaches, dry mouth, or grogginess, this is one of the first positions worth improving. Sleeping face down. Sleeping on the stomach can feel cozy, like being wrapped and grounded. But for older adults, face-down sleep often forces the neck to rotate for hours, and it can also press the chest into the mattress. That combination can make breathing less efficient, and it can create long periods where the neck and shoulder area are under pressure. Even without any dramatic symptom, reduced comfort in the airway can lower oxygen levels a little, and repeated low oxygen can put stress on circulation regulation overnight. In addition, the head turned sharply to one side for a long time can irritate the neck, increase stiffness, and in sensitive people it may contribute to less comfortable blood flow patterns. If you're a stomach sleeper, the safest transition is usually side sleeping with better alignment. Choose a pillow that keeps your head in line with the spine, not tilted up or down. If you need the feeling of support, hug a pillow in front of your chest and place one between your knees. It can give you that secure feeling without twisting your neck. If you snore, have sleep apnea, or use sedating sleep aids, stomach sleeping is especially worth reconsidering because your body may not adjust as quickly during the night. Pulling a heavy blanket over your head. Many people do this without thinking. To block light, to block noise, to stay warm. It can feel like a safe cocoon, but the space under a thick blanket can trap exhaled air. Over time, that can mean less fresh oxygen and more carbon dioxide around your nose and mouth. When you are younger, your system may tolerate it. As we get older, the brain and heart often do better with steady, clean airflow. If you wake with a headache, dry mouth, heavy fatigue, or a racing heart feeling, restricted airflow is one habit to check. You do not need to give up comfort. Instead, try a sleep mask for light, earplugs or white noise for sound, and breathable bedding for warmth. If you love the snug feeling, use the blanket up to the shoulders, not over the head. That one change can make your airflow cleaner all night. Sleeping upright in a recliner. Recliners feel like relief for sore hips, aching backs, reflux, or breathlessness. And for naps, a recliner can be fine. The concern is long nightly sleep in a chair where the body is bent, the neck is forward, and the legs are still for many hours, when the legs stay still and lower than the heart. For a long time, circulation in the lower limbs can get sluggish, especially in older adults with swelling ankles, varicose veins, or limited mobility. Sluggish flow can be uncomfortable and can contribute to clot risk in people already prone to circulation problems. If a recliner is your only comfortable option, do two things. First, aim for a position that supports the head and neck so your chin is not tucked. Second, support the legs so they are not hanging downward with pressure behind the knees. Gentle leg movement during the day also helps. Even ankle circles and short walks around the room can support better flow. If you can, consider an adjustable bed or a wedge setup that elevates the torso while keeping the body more evenly supported than a chair. Part 2. Sleeping on your right side with your arm under the pillow. This is one of the most common habits. You roll onto your right side, you slide your arm under your pillow, and it feels instantly familiar. The issue is not the side itself. The issue is hours of pressure on the shoulder, the arm, and sometimes the neck, plus reduced space for the chest to expand. When your arm is pinned under your head, nerves and blood vessels in the shoulder can get compressed. That can lead to numbness, tingling, and micro-awakenings that you do not remember. Over time, it can also encourage you to twist the neck forward and down, which is not ideal for breathing. A simple fix is to bring your arm forward, like you are gently hugging a pillow instead of placing it underneath your head. Use a pillow that fills the gap between your neck and the mattress so your head stays aligned. If your shoulder hurts, a body pillow can prevent you from rolling too far forward. Many people also find that left-side sleeping feels easier for breathing and comfort, especially if they deal with reflux. If left side feels good for you, that is a useful upgrade. If it does not, the main priority is alignment and keeping the arm free. Frequent tossing and turning restless sleep is common after 60, but it is not something to ignore. Constant shifting can be a sign that your body is struggling with pain, temperature, breathing, or pressure regulation. It can also keep you from reaching deeper sleep stages where the body tends to stabilize pressure and recover. Instead of blaming yourself for moving too much, treat it as information. Ask what is driving the restlessness. Practical checks that often help. Keep the room cool but not cold. Use layered bedding instead of one heavy blanket. Avoid caffeine late in the day. Avoid large amounts of fluid right before bed, but do not go to sleep dehydrated. Support joints with a pillow between the knees and another to hug if the shoulders ache. Try slow breathing for 3 to 5 minutes before sleep to reduce stress arousal. If a partner notices loud snoring, pauses in breathing, or if you wake with headaches or intense fatigue, a sleep study can be worth discussing. Better breathing at night often improves everything else. Skipping blood pressure or heart medication before bed. This topic is important, and I want to handle it responsibly. You should never change medication timing on your own. But consistency matters. Many older adults occasionally forget a dose or decide to skip it because they feel fine or they are tired. The issue is that the body has a natural early morning rise in stress hormones and pressure. For people managing blood pressure or rhythm issues, missing a dose can mean less stability during the exact window when the body is already shifting. The safest approach is routine. Use a pill organizer, set a phone reminder, keep a simple checklist. If you are worried about side effects, talk to your clinician rather than adjusting on your own. The goal is steady support, not sudden changes. If you ever feel lightheaded at night, extremely weak in the morning, or you notice new symptoms after medication timing changes, that is a signal to get medical guidance promptly. Sleeping in a cold room without proper neck support. A cool room can help sleep, but too cold, especially with poor pillow support, can lead to muscle tightening in the neck and shoulders. Tightness can push the head into awkward angles, and awkward angles can affect breathing quality. When breathing becomes less smooth, circulation regulation tends to work harder. Focus on 2 upgrades. First, temperature. Many older adults do well in a room that is cool, not chilly. Second, pillow support. Choose a medium firm pillow that keeps your head in line with your spine. If your chin is pushed toward your chest, adjust. If your head is tilted far to the side, adjust. Neutral alignment is the target. If you have neck arthritis or wake with neck pain, consider a contoured cervical pillow or a simple rolled towel inside the pillowcase to support the curve of the neck. Small comfort changes can reduce restless turning and improve airflow. Going to bed immediately after a heavy meal or alcohol. Many people feel sleepy after a big dinner, and some people use a drink as a nightcap. The problem is not enjoyment. The problem is timing and load. Heavy meals close to bedtime can worsen reflux and can disrupt breathing comfort. Alcohol can make you feel drowsy at first, but it often fragments sleep later in the night and can worsen snoring and airway relaxation. If you want the most brain-friendly routine after 60, aim for this. Finish heavier meals at least 2 to 3 hours before lying down. Choose a lighter evening option if you eat late. Drink water with dinner. If you drink alcohol, keep it moderate and earlier, not right before sleep. If you notice that you wake at 2 or 3 a.m. with a racing mind, sweating, or restless discomfort, late food and alcohol are common triggers. Closing message. If you listened through all 9, here is the big takeaway. Sleep is not only rest. Sleep is your nightly reset for circulation, breathing, and pressure balance. Most people focus on how many hours they sleep, but after 60, the way you sleep can matter just as much. You do not need dramatic changes. Start with 1 upgrade tonight. Raise your head slightly if you sleep flat. Move away from stomach sleeping if you can. Keep blankets below the shoulders, not over the head. If you use a recliner, support your neck and legs better. Keep arms free, aligned and supported. Treat restlessness as a signal and improve comfort. Follow medication routines exactly as prescribed and use reminders. Keep the room cool but not cold and support the neck. Give your body time after heavy meals and keep alcohol earlier. Your goal is simple: a calmer night for your body and a steadier morning for your mind.